We are the Pennywise Planners. You understand why that's our name soon enough. Now I know you're wondering what I'm doing on your screen, but don't worry, I got you. We were given an assignment to see real-world business practices, and we decided to focus on the theme health and safety. Now before I carry on, what is health and safety? Health and safety aims to prevent harm to individuals by managing risks and creating a secure and healthy working environment. We had to put our creative thinking caps on, and that's how the idea to look into the eThekwini Municipality was born. We looked into both the history and the current state of its health and safety practices. Our aim was to better understand how the municipality protects its businesses and the community and how these efforts have changed over time. Our presentation will reflect our findings and insights based on research and observations. My colleagues will identify hazards that the municipality has identified themselves and that we also have identified and will provide solutions.
Waste management issues at Durban. In the Shepstone Road, there is a vacant land used for dumping construction rubble, plastic and toxic waste. That has affected the city of Durban and the neighboring communities in a very bad way. eThekwini has also adopted a zero-tolerance policy whereby individuals and businesses have to pay a fine of up to 500 rand if they do not comply with the rules and regulations provided by the municipality. To avoid future dumping, the municipality has deployed different constructors to help clean. Durban was once known as a beautiful city with clean and safe streets, and the city was very popular to the tourists. But over the years, the tourist numbers has depreciated because of the unclean roads. The video below shows one of the streets of Durban where a sewage pipe has burst, resulting to unclean air and streets. And to be honest, no tourists would want to pay their money to visit a place where pop is roaming the streets.
We will then now shift to the flood disaster response report. In April 2022, the eThekwini municipality experienced devastating floods that resulted in a significant health and safety crisis, including disruption of homes and disruption of essential services. This report outlines the municipality's response to the disaster, highlighting the emergency protocols implemented to mitigate the impact on the affected. These are the challenges that were encountered by the eThekwini municipality during the floods. There was a policy limitation where emergency shelters had to be vacated due to policy limits. This highlighted the need for more sustainable solutions. The second problem encountered were the infrastructure destruction. The destruction of infrastructure and essential services posed a significant challenge to the municipalities, which impacted the response efforts and overall recovery process. The lesson learned during the floods was the importance of preparedness. These floods highlighted the importance of preparedness and disaster planning, which means that municipalities should prioritize disaster risk reduction and management.
As my colleague, Mr. Sontobe, regarding emergency protocols, has mentioned that the eThekwini municipality disaster management and other emergency services are always on standby and monitoring any potential impacts from the implemented weather and other situations of emergency. To add on what Mr. Sontoba has mentioned, as a group we have decided to go to fire station department to find more information about how they use their equipment when they are on duty or when there is an emergency situation regarding fire. We also found that fire station department don't deal with fire only, but they also deal with emergencies like accidents and other emergencies. We interviewed the employees about how they do their work and also took some pictures with them. Here are some solutions that we found that municipality had implemented regarding floods that were taking place in KZN. The municipality had ensured that emergency services are equipped to respond to flooding and erosion events. The eThekwini Municipality's Disaster Management Unit provided critical support during emergency situations. I thank you.
We had the opportunity to learn about the critical work that firefighters do and the challenges they face. One of the key takeaways from our visit was the importance of water supply in building for fire emergencies. We learned that firefighters often arrive at the scene where buildings lack adequate water supply, making their job more difficult. This highlights the need for proper infrastructure and planning to support firefighting efforts. We also learned that firefighters don't just respond to fires. They also deal with other emergencies like car accidents and medical situations. Their work requires quick response times, and we were impressed about their ability to get ready and respond to emergencies within 45 seconds.
Protests and strikes is the eThekwini Municipality health and safety issue. Although strikes and protests are protected under the South African Constitution and the Labour Law, but they often create health and safety risk for both employees, residents, and municipality operations. For example, physical harms. Workers on strikes may face intimidation, assaults, or threats, or the exposure to violence, like a case in DUT where 30 students armed with rocks and bricks tried to enter the campus through an administration building. This is when shooting allegedly took place. Then there was a death of our fellow schoolmate Lungis Madonzel and a July 10, 2021 looting that followed after the arrest of former President Jacob Zuma. A protest escalated into a widespread looting, vandalism, and destruction across KZN, specifically in eThekwini.
Hi everyone. So during our research on the Durban July, here's what we found. Firstly, overcrowding is one of the biggest issues with over 45,000 people attending in 2025. It becomes really hard for emergency services to move around if something goes wrong. The eThekwini municipality has to work with Metropolis, private security just to keep things under control with barriers, entrances and signage. Secondly, alcohol consumption goes way up during this event. That means more drinking and driving, more accidents, and unfortunately, even violence. Hospitals actually see a spike in trauma cases from overdoses to stabbings because alcohol laws ain't really managed properly during this event. And thirdly, crime is a serious concern. Big events attract pickpocketing, theft, and even serious cases like car hijacking. Businesses also suffer because they are forced to spend more on security and protect their stock. So while the Durban July is an iconic event, it's also bringing real challenges when it comes to health, safety and security. That is what our research highlighted. Thank you.
In eThekwini, holidays like Passover or Easter weekend and December festive season bring excitement, family gatherings and big crowds. Unfortunately, they also bring a higher risk of accidents, injuries and other health and safety problems. More people are on the roads, beaches are packed, alcohol consumption increases and summer weather can be unpredictable. While the municipality and its partners prepare for these challenges, it is important for residents and visitors to be aware of the main risks.
In the slide, I will be speaking about the issue of deaths and pollution in Durban and how it affects the community. As you all know, Durban faces a serious challenge with waste build-up, especially in busy areas and informal settlements. This does not only make the community look untidy, but it also affects people's health. Uncollected rubbish attracts pests such as flies and rats, which spread diseases like cholera, malaria, diarrhea, typhoid, and respiratory infections. The polluted environment also contributes to blocked drainage systems, which cause flooding and make conditions more unsafe. To better understand the situation, my group and I visited the municipality. The officials explained some of the solutions they are working on, such as improving waste collection schedules, increasing recycling awareness, and running community cleanup campaigns. They also highlighted the importance of educating citizens about responsible waste disposal. They further mentioned possible future solutions such as introducing stricter fines, providing more public bins in high traffic areas, and expanding recycling programs in schools and businesses. In conclusion, the fight against dirt in Durban requires cooperation between municipality and the community. If everyone plays their part, we can reduce diseases and create a healthier environment for all.
HIV and AIDS are considered as health hazards due to their impact on the immune system and overall health. Here's how they pose risks. HIV is known to weaken the body's ability to fight infections and diseases, whilst AIDS is known to be an advanced stage of HIV. AIDS is a life-threatening illness which also reduces the quality of life. Weakened immune system increase vulnerability to infections and diseases. Not just any diseases, but life-threatening diseases such as certain cancer, pneumonia, tuberculosis, etc. In the past years, we have seen HIV and AIDS destroying our communities and businesses. Companies have lost their skilled workers due to HIV and AIDS. Families have lost their breadwinners, leading to economic and emotional burden. The eThekwini area is reported to have the highest rates of HIV and AIDS. This was revealed on the 23rd of November 2022 at the mayoral engagement held with people living openly with HIV and AIDS. We, the Pennywise Planners, as it shows on our slides, we have gone and did our research on our local clinics to find out what our municipality did to come up with the solutions to protect our community and businesses from HIV and AIDS. These are the solutions that they have come up with. Firstly, they have come up with the emergency protocols for HIV and AIDS, where we're looking at the strategies to prevent HIV and AIDS transmission, such as the use of protection correctly, regular testing which helps identify infections early, and enabling timely treatment and prevention. Also, ongoing care and support helps those living with HIV and AIDS. Another thing, there must be trained first aid officers for on-site emergency response and safety on every company. After setting the emergency protocols, they then come up with the legal compliances for HIV and AIDS, which are as follows: upholding the rights of individuals living with HIV and AIDS, applying SAGA guidelines for local government on HIV and AIDS, and aligning with national test and treat policy. By working together and implementing these solutions, we can reduce the impact of HIV and AIDS on our community and businesses.
In conclusion, our research into the eThekwini Municipality's health and safety practices has highlighted a wide range of hazards that impact both the community and local businesses. These include natural risks such as floods and water shortages, as well as human-related issues like waste management challenges, HIV, road accidents during holiday periods, and alcohol-related incidents at large events such as the Durban July. However, our study also revealed areas where improvement is still needed. As part of this assignment, we not only examined the municipality's existing strategies, but we also proposed our own solutions to strengthen the health and safety practices. These solutions were aimed at enhancing preparedness, improving community awareness, and ensuring a more sustainable approach to risk management. In the beginning of this presentation, I said you would soon understand why we are called the Pennywise Planners. I'm pretty sure you understand it now. All the solutions that my colleagues have proposed are Pennywise, and they are well planned out. This means that it will save the municipality a lot of money and involve the community, which is a wise decision. Thank you so much for tuning in. See you next time.